Okay. All right. So let's go ahead and get started. I have that it's 4 minutes after 11 o'clock, and I want to just welcome everyone to the Healthy Minds Alliance information call. My name is Trisha Harity, and I am the Executive Director of Health 360. So I'm really excited to speak with you today regarding this opportunity for your agency to join Healthy Minds Alliance. And I will take about 35 minutes and sort of run through my checklist of all the information that I want to give on the call. And then at the end of that time, I'll open it up for questions. So if questions are coming up as I'm speaking, just jot them down, and then we'll have question and answer at the end. So everyone is on mute. I see that. Thank you. And so just remember at the question time to unmute yourself if you do have a question. All right. So again, welcome to the call. I'm super excited to be here today. This is our third and final informational call. So just some background information. Healthy Minds Alliance is in the business to help people thrive. And we do that by working to ensure that everyone has equal opportunity to live a long, healthy, and productive life. So the program that I'm talking about today is Healthy Minds Alliance. And through Healthy Minds Alliance, we use AmeriCorps National Service to help expand capacity at partner organizations and expanding that capacity to meet current and emerging mental health needs in the local community. So through our Healthy Minds Alliance program, we partner with agencies across the nation, and those agencies host one or more of our Healthy Minds Alliance AmeriCorps members. So that is a question that I always get. Is this program, Health 360 is located in Connecticut, so people are confused, and that we do place our Healthy Minds Alliance AmeriCorps members at agencies nationwide. So you don't have to be from Connecticut to participate in this program. So we have a variety. So Healthy Minds Alliance is in its eighth year of operation. And over those 8 years, we have partnered with a large variety of organizations. We have worked with hospital systems, community health centers, school systems, K through 12, colleges and universities, mental health providers. We've worked with national affiliate organizations like NAMI or Mental Health America. So that's a list of some of our partners. So we are interested in to continue to work with partners that are on that list, but also to expand that list and the types of organizations that we work with. So we have a big tent here at Healthy Minds Alliance, and we're really interested in building partnerships across all sectors. So basically, Healthy Minds Alliance, we place one or more AmeriCorps members at our partner organizations. That AmeriCorps member is trained in a mental health gatekeeper training. The gatekeeper training is of the choice of the host site. So sometimes there's some confusion around this too. Through the host site application, our prospective host sites really describe the training or intervention that they want their AmeriCorps member to focus on. So it is the choice of the host site. However, I always get the question, what are some examples of mental health trainings that host sites have done in the past? So currently this year, several of our host sites are implementing mental health first aid. So their AmeriCorps member is trained as a mental health first aid instructor, and then they're teaching and certifying individuals in mental health first aid. So that's one example. Both the adult and the youth program and the teen program as well. So a lot of mental health first aid going on out there through Healthy Minds Alliance. We also have host sites that are implementing QPR, which is a suicide prevention program, question, persuade, refer. So those are some examples of programs that our host sites are currently doing. We also have host sites that are doing agency-specific training. So while mental health first aid and QPR are national programs, and anyone with the credentials can get trained as an instructor and implement that program. For instance, we work with some NAMI affiliates, and NAMI has a program called peer-to-peer. So one of our AmeriCorps members is trained. They serve at NAMI. They're trained in this NAMI program. And they are implementing that program. So that's something that is only done through NAMI affiliates. So those are just some examples. And we really do put the ball in the host site's court. And we want you to really describe to us the need in your community and the intervention that you would like the AmeriCorps member to be focusing on. So that's just information on the trainings that are appropriate. So once the AmeriCorps member is placed at the host site and the intervention is identified, then the AmeriCorps member really focuses their service year teaching or implementing the mental health first aid training in the community. The AmeriCorps member, in addition to providing training, they are also able to spend their service hours on other mental health focused initiatives. So for instance, in my example of an AmeriCorps member who might be teaching mental health first aid in the community, they're not necessarily teaching mental health first aid 40 hours a week. They might be teaching one class a week, maybe 1 or 2 classes a month. So there is definitely room, and we encourage our host sites to really think of how else the AmeriCorps member can be using their service time to really advance mental health initiatives at their host site. And that's also a question on the host site application. What are some other duties or other things that the AmeriCorps member will be focusing on during their service year? And we're really looking for the host site to think through as robust a service year as possible for the AmeriCorps member. All right, so Healthy Minds Alliance, we really, I toot my horn a little bit on these calls. Healthy Minds Alliance really has pioneered the use of AmeriCorps National Service towards solving the mental health issues in communities nationwide. And we really think of the Healthy Minds Alliance as part of a movement in the United States to address the mental health crisis in our nation. And we definitely have seen over the year of COVID-19 lockdown, just increased need potentially in communities, people affected by the pandemic, and seeing increased needs in communities for people who are struggling with mental health challenges and mental illnesses. So we are really psyched to be on that team and excited to be in this process right now. I'm looking to recruit organizations like yours into our alliance and becoming part of Healthy Minds Alliance. Okay. So I'm going to go through some nuts and bolts, all things AmeriCorps. So I like to let our potential host sites know you do not have to have experience with AmeriCorps to be to apply for this program. Some host sites have had AmeriCorps members serving in the past, and that's okay too. We do ask that on the host site application if you have any experience with AmeriCorps, but it is not a disqualifying question. If you answer no to that question, you're not disqualified. We just want to get a sense of where our host sites are in their knowledge of AmeriCorps. So it is absolutely okay if you even have never heard of AmeriCorps. We will teach you about AmeriCorps and get you to know and love AmeriCorps just like we do. So the AmeriCorps members, essentially what we're doing is placing an AmeriCorps National Service member at host sites nationally. The AmeriCorps member, they are full-time, which means they are serving 40 hours a week for a total service commitment of 1,700 hours. And if you do the math, an AmeriCorps member who is serving on average 40 hours a week, they will complete their 1,700 service hour commitment in about 10 months. So when you have a Healthy Minds Alliance AmeriCorps member serving at your agency, you really have someone there 40 hours a week for approximately 10 months. Although the AmeriCorps member does have a full 12 months to complete their service commitment. And that just leaves room, if an AmeriCorps member were to get sick or had, a trip planned or something, there is wiggle room for them to be able to, sort of continue with their life's activities and still be able to serve as an AmeriCorps member. AmeriCorps member, they get several benefits, and I'll describe them now. First, they do get a stipend or a living allowance, and the living allowance for the upcoming service year, the 2021-2022 service year, is $15,100. So this is a benefit that they receive biweekly over their service term. They also receive an education award in the amount of $6,342. Now that Ed award is given to them or paid out to them after they complete their service term. That education award is money that can be used to pay for current federal student loans that they might already have, or future educational expenses, higher education expenses. There's also student loan forbearance. So if the AmeriCorps member has current student loans, when they are serving as an AmeriCorps member, they are not required to pay those loans. So we put those loans in forbearance, and they're pretty much just frozen during their service term. So they don't have to worry about paying their monthly payment on that loan. Also, any interest that is accruing on the loans while they served is paid for by the program. So that's just another benefit. All of these benefits are administered by Health 360. So we pay the stipend, we pay that biweekly stipend to the AmeriCorps member, and they can use that money to defray living costs. We also pay the $6,345 education award. That is put into what's called the National Service Trust for the AmeriCorps member. And then the AmeriCorps member can use that to pay education expenses. Health 360 covers that as well. And then we also help this, if they want the AmeriCorps member to put any student loans into forbearance and cover those interest costs that accrue while they're serving. So all of those monetary benefits are covered by Health 360. The Healthy Minds Alliance AmeriCorps service year, our year begins September 1. So for this upcoming program year, the 2021-2022 program year, our members start on or after September 1st, 2021. So just as far as a timeline, if you are hosting an AmeriCorps member, the earliest that they can start would be September 1st. Most of our members do start at the beginning of that year, either in September or October. However, we are able to start our members anytime during the service year. So that would be September 1st, 2021, all the way through August of 2022. So sometimes we have a host site who has a really good reason why they would want their AmeriCorps member maybe to start in January or in March or whatever it might be. And we can accommodate that if that makes sense for the host site. So, but like I said, most of our members do start either in September or October at the beginning of the program year. Okay, so AmeriCorps member recruitment. So I always just like to joke, we don't have AmeriCorps members sitting on a shelf here at my office that we send out to our host sites. There is a recruitment process that happens. So once our host sites are chosen at the end of April, we work with them immediately to start this recruitment process. And there are several things that are happening here. We put all of our new host sites up on the AmeriCorps portal. So people who are interested in serving as an AmeriCorps member, they can go on that AmeriCorps portal. They can see, oh, Healthy Minds Alliance at I'm making up at Compeer in Buffalo. I'd like to serve there. And we will get applications, we meaning Health 360. So as we get applicants from the AmeriCorps portal, we send them out to the host site. We also work with the host sites to place a position description locally. And so through that local position description, the host site might also get interested candidates. So there's sort of a two-track way to get for potential AmeriCorps members to apply for the position. And we really do rely on the host site to administer that process. So like I said, we'll be sending you applications that we get from the portal. You'll be getting applications from your local recruitment efforts. And then the host sites are doing the interviewing and the selecting of the candidate. So we provide you support and technical assistance. We give you everything you need to be able to do this process, but we do rely on you to do those interviews and to select the candidate that's going to fit best with your agency. So that's an important point, because that process starts as soon as our host sites are selected at the end of April. We start the process of recruitment. So our host sites have to be ready to go. We have to have somebody at the host site who is going to take this lead and take the responsibility to get this done. And it pretty much runs like, interviewing for employees. It's sort of the same process, although AmeriCorps members are not employees. We are bringing them in as a national service member for a 1,700-hour service term. So they're there for about 10 months, no more than a year, and then their service term is done, and then they move on. Okay. So once the AmeriCorps member is selected by the host site, then Health 360 really takes the ball back at that point. And I go through this process because some of our host sites or potential host sites, they have worked with AmeriCorps before. And sometimes it wasn't the best experience, maybe. There's a lot, AmeriCorps is a federal program. And there are a lot of I's to dot and T's to cross when it comes to enrolling a new AmeriCorps member. There's a lot. So Health 360 is really the expert in that. And we take the lead. We really do that process. So our host sites are not involved in that. They don't have to worry about some of the ins and outs that in the enrollment process. There's a lot of paperwork that has to be collected. We have to do background checks, et cetera, et cetera. So we sort of take that process and we push the AmeriCorps member through the enrollment process, and we take care of that for our host sites. And like I said, we also take care of the biweekly stipend payment, the education award. So I don't know if I already said this, but we really are the experts in running AmeriCorps programs, Health 360 and my staff. We don't expect our host sites to be AmeriCorps experts. We want you to be the experts in really building a robust service year for your AmeriCorps National Service member. So we try to lift that burden off of you. Okay. All right, so that's AmeriCorps member. And then a little bit, I'm going to still talk a little bit about host site responsibilities. So we do have, so once our host sites are chosen, the first thing that the host site has to do, other than start the recruitment process, we do ask each of our host sites to sign our host site agreement. So I'm just going to navigate. I'm hoping that you can see my the Health 360 webpage, and I do recommend that in this application process, so I just navigated to the landing page for Healthy Minds Alliance on Health 360's website. And if you scroll down, this is where you'll find the host site application. So this is the application that's due at the end of April, or I mean, it's due April 15th actually, or 16th. I should know that date. Let me be specific, hold on. Due April 16th. So this is where you would access the host site application. We also provide a Word and a PDF version of the application. And we do that because once you are completing the online application, we don't have a save feature. So you sort of have to go in, complete it, and submit it kind of in one fell swoop. So, so I recommend really take this Word version, do it offline. And then when you're happy with the application, just cut and paste it into the online portal. So that's just a little Healthy Minds Alliance host site application hack. So we do provide that for you. But I also want to point out right below it, we have what's called our host site agreement. So some people submit both of these when they're applying, and you don't have to. I'm only looking for the application by April 16th. If your agency is chosen as a host site, then I will ask you to complete the host site agreement. However, while you're applying, I think it's a really good idea to have at least read the host site agreement, because this is something that you as a new host site will be required to sign. So I want you to know what's in there and be familiar with it, and be, feeling like, yes, this is something that my agency will agree to sign. There's nothing hokey in there, but it's really details. There's a lot of details in there about the relationship between Health 360 and our host sites. So take a minute to read through that and get familiar with the host site agreement. However, that is not due on the 16th, only the application is. We do ask that the host sites assign a site supervisor. That's a question on the host site application. So hopefully you have someone at your agency in mind to be the AmeriCorps member supervisor. Sometimes people don't, and that's also okay if you don't have someone. But what we do ask that you at least describe who you think that person is going to be. And the supervisor has to know that they are required to go through a background check. So we are required to do background checks on all of our host site supervisors. So it's spelled out in the application. And that position is super important because, like I said earlier, once we choose our host sites, we get started right away with recruitment. So we need someone identified at the agency who is going to participate in that recruitment process. Okay, let's see. There is a host site fee that goes along with participating in the Healthy Minds Alliance. So the host site fee for each AmeriCorps member slot, it's a $10,000 host site fee. So I want that to be crystal clear. I sort of outlined earlier a lot of the cash outlays that Health 360 is doing with the living allowance and the Ed Award, et cetera. We do have, so our host sites pay into the program $10,000 per AmeriCorps member slot. And what we do allow our host sites to pay that in a variety of ways. They can pay it in one lump sum right up front at the beginning of the service year in September. You can elect to pay quarterly in 4 quarterly equal payments quarterly over the service term, or we do a monthly payment and we spread monthly payments over 8 months. So sometimes that's helpful. If you don't have the $10,000 to pay right up front, you're able to sort of push that along the service year. Sometimes I get a question, there might be some funding available that has to be put out into the world earlier than September 1st. And we're able to work with host sites that way too. So I can send the invoice for the host site fee as early as May, once that we get our host site set. So if you have a grant that you're working on and looking to spend down funds, that's something that can also be accommodated. Let's see. We also, I also want to make sure that the host sites understand that there are some out-of-pocket costs associated with hosting a Healthy Minds Alliance AmeriCorps member. So depending on the training or intervention that you're doing, there might be costs associated with that. that the host site incurs. So I'll go back to my mental health first aid example. So mental health first aid, there's about a $20 to $25 fee to train someone in mental health first aid. So that is a cost that the host site pays. Also, we ask the host site to cover cost of travel. So just like you likely do for employees at your host site, any travel that the AmeriCorps member is doing above and beyond their daily commute, that you provide a mileage reimbursement. So again, sometimes there's no travel at the host site. Other times there's a lot. So because the AmeriCorps member is on a really tight living allowance, I've had AmeriCorps members sort of, in this example, they were in a very rural area and they were traveling like 200 and 300 miles a week above and beyond their daily commute into the office. So if that's the situation at your host site, we do expect that the AmeriCorps member would be reimbursed for mileage, again, above and beyond their daily commute. Okay. I see some, I'm just going to plow through. I do see some questions coming in the chat. I'm not even looking at them right now, but I'll look at them when I'm done. I have just a few more comments. I do want to let, so I have the timeline here. So I'm just going to sort of run you through the host site application. It is due on April 16th. So that's coming up in 15 days. We will send notice of if you were selected as a host site by April 30th. So we turn those applications around really quickly and we let everyone know if good or bad news by April 30th. And then we do have, there are two mandatory meetings that I'm going to talk about right now. We do have we call it our orientation conference call, and we do that. The dates are selected as May 27th or June 2nd. So we run the same call twice, and we need somebody from our host site on one of those calls. They are 1 to 2:30 Eastern time. And it's on those calls that we really kickstart the AmeriCorps member recruitment process. So we walk you through AmeriCorps member recruitment. We give you all the tools that you need to get this done. And then we support you through the process. So those are important dates. Again, that's May 27th or June 2nd, 1 to 2:30 Eastern. We also have what we call our Strong Start webinar. And we do that. Again, this is a mandatory meeting. We need somebody from our host sites on these webinars. Now, this is a two-part series. So the dates are August 17th and August 24th. So this is a two-part series. So our host site supervisors have to be on both. And those run from 1 to 3, again, Eastern time. And it's at that time that we really orient our host site supervisors to AmeriCorps, to the Healthy Minds Alliance program. It's really giving them all of the information and tools and setting everyone up for a strong start. And those webinars really proceed. If your member is getting ready to start in September or October, we give you that information right in advance of the AmeriCorps member start. So again, those dates are August 17th and August 24th, 1 to 3 Eastern. And then, like I said, our AmeriCorps member start date, they can start on or after September 1st, 2021. Okay, and then quickly, I want to just talk about the evaluation. So we do have an evaluation process. All of our host sites and AmeriCorps members have to participate in the Healthy Minds Alliance evaluation. This is how we collect data to report back to AmeriCorps. We ask that each of our members, at a minimum, train or certify 150 people in the mental health training or intervention that the host site chose. So that's the minimum, 150. Of all the people trained, they must complete a pre and a post survey. Those surveys are, created. We have them. They're ready to go. But it is a requirement that anyone that the AmeriCorps member is training, they must complete the pre and the post survey. We use that survey to track increase in knowledge, and that is the outcome that we're reporting to our funder. So I put this on this call because a lot of my host sites, they have their own evaluation that they're doing, and that's expected. We're all required to do evaluation, but it is a requirement that this pre and post survey be completed. So sometimes that means that there are 2 surveys going on, because if our host site has their own process and they are not, pushing that out of the way because of what we're doing with Healthy Minds Alliance, then that's where we are. So we work with our host sites as best we can for it to not to be too much of a heavy lift. Our surveys are super short. They can be done online if we want. I also have at Health 360 my IT administrator, George Martinez, and he really provides all the training and support that our host sites need to do the evaluation. So we have an online system. We've been using it for 8 years. It's super refined. It works very well. But we are able to provide training on how to use it. And then if there are any snafus during the service year, whatever, George is in the saddle, ready to help. No worries there. And then lastly, I am almost done. I just want to point out, I'm going back to the website, and I just want to point out, this is our landing page for Healthy Minds Alliance. I did already show you where the application is and the host site agreement. I also scrolling down to the very bottom of the page, and there's a link here for HMA documents, Healthy Minds Alliance documents. So if you click there, there's some other documents here for you to take a look at. And it's a good idea to look at these, as you're completing the application. The member position description is here. You can see the pre and post survey. We have a sample budget, some restrictions that go along with hosting an AmeriCorps member. So I just point out those resources and, take a second to look those over as you're deciding to apply or in the process of applying. Okay. So that is all that I have on my list. So what I'm going to do now is stop talking and I'm going to open it up. So I'm just opening it up now to questions. There's just feel free to unmute yourself and go ahead, and I'm happy to answer any questions that you might have. I'm looking at the chat right now. It says, does the host site have to pay a fee to help offset some of the costs of the AmeriCorps member? Yes, so I think I covered that. We do, that's what I consider the host site fee. So there's a $10,000 host site fee per AmeriCorps member slot. And then it says, do you know if there are grants available to pay for host site fees? So I know that host sites in the past have received grants to cover the host site fee. So for instance, one that I know of is the MHAT funding, Mental Health Awareness Training, which is a grant from SAMHSA, Substance Abuse Mental Health Services Administration. So I have had host sites who were MHAT grantees, and the host site fee was part of their MHAT budget. I've also had host sites, so that's just one that I happen to know off the top of my head. I've had host sites also successfully apply to like local, community, or state foundations, and were able to secure money for the host site fee. So yes, our host sites have been successful applying for grants to cover that host site fee. So I think that's all that was in the chat. So that now I will get quiet, and if there's any other questions out there, I'm happy to answer them. And remember, you're on mute. So if you think you're answering a question right now and you didn't unmute yourself, I'm not hearing you.
Hi, Tricia. Thanks for doing this. Just wanted to ask about how many awards you expect to be giving and typically how many applications you might get for that number of awards.
Yeah, that's a good question. So we are, currently we have 20 slots. We have applied to AmeriCorps for an additional 10 slots. I have not officially heard that we're going to get those 10 slots, but I am super optimistic that we are. So I'm hopeful that for the year starting in September 2021, we will be placing 30 AmeriCorps members. So we are looking for host sites to take those 30 AmeriCorps members. I do have current host sites, so I will be transparent. Those host sites who are currently participating in the program, if they apply to continue into next year, they get preference. So I don't know how many of my current 20 host sites are going to apply for the new year. It usually runs about 50% or so. So I'm expecting about 10 of my 20 existing host sites to continue into the next year. So that leaves another 20 slots for new host sites. And I typically get between 50 to 70 applications during a cycle. So it's like competitive, but not, that's, and every year is different as far as those number of applications that I get, but that's usually where we fall between 50 and 70. Okay, thank you. Yes, it looks like I answered that question. You're welcome. Any other questions out there? Okay. All right, so I'm going to conclude the call, and what I will do is, I should have done this earlier, I'm going to put my email in the chat, and if any questions come up during this process, feel free to give me an email. I'm happy to answer questions, offline. Don't hesitate to reach out. I always say my most favorite thing to do is talk about Healthy Minds Alliance. So if any questions come up while you're completing the application, reach out to me and I'll do the best I can to answer them. Okay.